Does gout only affect the joints, and is its treatment temporary or permanent? Let's learn about this and everything related to gout. Gout is a type of arthritis that occurs as a result of the accumulation of uric acid crystals in the joints, and there are many reasons that lead to high levels of uric acid in the blood and its accumulation. 1. Increased production of uric acid in the body, following a diet rich in purines. Eating foods rich in purines such as red meat, liver, kidneys, and seafood, such as sardines, mackerel, leads to increased production of uric acid in the body. Obesity. Excess weight increases the production of uric acid and puts additional pressure on the joints. Genetic factors. Some people are more susceptible to gout due to genetic factors that lead to increased production of uric acid. Kidney problems. Healthy kidneys help get rid of uric acid from the body. In the event of kidney problems, uric acid accumulates and leads to gout. Some medications such as diuretics, used to treat high blood pressure, and aspirin can reduce the body's ability to get rid of uric acid. Sweetened drinks. Soft drinks and drinks containing fructose contribute to increased uric acid levels. Fourth, medical conditions associated with high uric acid. High blood pressure. Untreated high blood pressure increases the risk of gout. Diabetes. People with diabetes are more likely to have high uric acid. Metabolic syndrome. This condition includes being overweight, having high blood pressure, and having high blood fat levels, all of which increase the risk of gout. Psoriasis. A skin condition that can increase the risk of high uric acid. Surgery or trauma can increase uric acid levels, leading to an acute gout attack. 6. Age and gender. Men. They are more likely to develop gout than women because they have had higher levels of uric acid since puberty. Postmenopausal women. Premenopausal women have lower levels of uric acid, but after menopause, uric acid levels may rise, increasing the risk of gout. 7. Dehydration. Dehydration can lead to higher levels of uric acid in the blood, increasing the risk of crystals forming in the joints. 8. Stress. Physical or emotional stress can cause uric acid levels to rise, increasing the risk of a gout attack. Symptoms. Severe joint pain. This often occurs in the big toe, but it can affect other joints such as the ankles, knees, hands, and wrists. Swelling and redness. The pain may be accompanied by swelling and redness in the affected area. A feeling of heat in the joint. The affected joint may feel very hot and sensitive. Difficulty moving. Severe pain may make movement in the affected joint difficult or painful. Symptoms worsening at night. Gout attacks may worsen at night. Sudden and recurring attacks. Symptoms come in sudden attacks that may last from several hours to days. Diagnosis 1. Clinical examination. The doctor will evaluate symptoms such as pain, swelling, and redness in the joints, in addition to reviewing the patient's medical history. 2. Blood tests. The level of uric acid in the blood is measured. High levels of uric acid may indicate gout, but not necessarily. Some people have high levels without symptoms. 3. Synovial fluid analysis. This is the most accurate test for diagnosing gout. The doctor takes a sample of fluid from the affected joint with a needle. Then the sample is examined under a microscope to look for uric acid crystals that indicate gout. 4. X-ray tests. X-rays are used to rule out other diseases that may cause joint pain, such as arthritis or fractures. How to prevent it? Preventing gout requires making lifestyle and dietary changes to reduce uric acid levels in the body and prevent its accumulation. Here are some effective preventive steps. 1. Follow a healthy diet. Reduce foods rich in purines. Purines are converted to uric acid in the body, so foods rich in them should be avoided, such as red meat, seafood, such as salmon and sardines, and internal organs. Eat foods rich in fiber. Vegetables and fruits help control uric acid levels. Increase your intake of low-fat dairy products. These products may reduce your risk of gout. Drink at least 8 glasses of water a day. 3. Limit your intake of alcohol and sweetened beverages. Sweetened beverages, especially those containing fructose, can increase uric acid levels and trigger gout attacks. 4. Maintain a healthy weight. Being overweight increases your risk of gout. Eating a balanced diet and exercising regularly can help maintain a healthy weight and reduce your risk. 6. Avoid medications that increase uric acid. Some medications, such as diuretics, can increase uric acid levels. If you are taking medications, talk to your doctor about alternatives. 7. Take preventive medications if needed. In some cases, your doctor may prescribe medications such as allopurinol or febuxostat to help lower uric acid levels if you have a history of gout or high uric acid levels. 8. Stay away from stress and tension. Stress may contribute to gout attacks. Foods that are recommended to eat are low-fat dairy products, such as milk, yogurt, and low-fat cheeses, as research indicates that they may help reduce the risk of gout. Vegetables. Although some vegetables contain purines, such as spinach and peas, they are not associated with an increased risk of gout. Fruits, especially cherries, as studies indicate that eating cherries reduces the risk of gout. 3. Increase water intake. Drinking at least 8 to 12 cups of water daily helps rid the body of uric acid and prevents its accumulation in the joints. Maintain a healthy weight. Eat low-calorie and low-fat foods to maintain a healthy weight. Losing weight reduces pressure on the joints and helps reduce uric acid levels. 5. Avoid long fasting or severe diets. Fasting or severe diets that lead to rapid weight loss can raise uric acid levels. 6. Foods that can be eaten in moderation. Animal proteins that are low in purines, such as chicken and turkey. It is preferable to eat them in moderate amounts. Fatty fish rich in omega-3, such as salmon, but it is preferable to eat them in moderation to avoid increasing purine levels. 7. Recommended drinks. Water. The best drink for gout patients. Coffee, green tea. It contains antioxidants that may be beneficial. By following this balanced diet, gout patients can reduce pain attacks and prevent the condition from worsening. There are several types of medications used to treat gout. Medications used to treat gout include 1. Pain and inflammation medications during acute attacks. Non-steroidal anti-inflammatory drugs. They are used to relieve pain and inflammation associated with gout attacks. Examples: ibuprofen, naproxen, indomethacin. They should be used as directed by a doctor, as they can cause stomach problems such as ulcers with prolonged use. B-colchicine. Commonly used to relieve pain during an acute gout attack. It works by reducing the body's response to inflammation caused by uric acid crystals. It should be taken at the beginning of the attack for maximum effectiveness. Possible side effects include nausea and diarrhea. Corticosteroids used if anti-inflammatories are ineffective or inappropriate for the patient. Examples: prednisone, given by mouth or by injection into the affected joint to quickly reduce inflammation. May have side effects such as high blood pressure and weight gain. 2. Medications to lower uric acid levels for prevention. A. Xanthine oxidase inhibitors. These medications work by reducing the body's production of uric acid, which reduces the risk of crystal formation. Examples: allopurinol and febuxostat. These medications should be used under medical supervision to avoid any potential side effects. B. Medications that increase uric acid excretion. Examples: probenecid. Increases the kidney's ability to get rid of uric acid. It can increase the risk of kidney stones, so it is recommended to drink plenty of water when taking this type of medication. Tips: use of preventive medications. Preventive medications are not recommended during an acute attack. Instead, they should be used after the condition has stabilized to prevent future attacks. Dosage follow-up. It is essential to adhere to the doses prescribed by the doctor to avoid side effects. Attention to nutrition and water. It is recommended to drink adequate amounts of water and limit foods that increase uric acid in addition to medications. Adherence to treatment and lifestyle control can help reduce the frequency of gout attacks and improve quality of life. The duration of gout treatment depends on several factors, including the severity of the condition, the frequency of attacks, and the type of treatment used. Treatment can be divided into two main stages: acute treatment of gout attacks and long-term preventive treatment. 1. Treatment of acute attacks. Duration of treatment. An acute attack usually lasts from 3 to 10 days. Pain and inflammation relief medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, colchicine, or corticosteroids are given. 2. Long-term preventive therapy. Duration of treatment. Preventive therapy varies from patient to patient, but usually lasts for months to years, or even life in some cases. The goal of preventive therapy is to keep uric acid levels low to prevent new crystals from forming and reduce the frequency of attacks. Medications such as allopurinol or febuxostat are used at this stage. Uric acid levels must be monitored regularly to ensure that the treatment is effective. It may take months to reach stable levels and prevent new attacks. Even with preventive therapy, occasional attacks may occur, but their frequency is much less frequent over time.